Movement is one of the best things you can do to help relieve pain and stiffness from degenerative disc disease. So in this video, what I'll do is provide a quick and easy 5-minute movement routine specifically designed to reduce stiffness with DDD. Let's go ahead and get started. So this 5-minute routine is all a ground routine, meaning we'll perform all of our exercises on the ground. So if you need a mat, go ahead and grab it, and we'll meet in our first position, which is in our hands and knees, and we're going to perform a cat-cow. So the full body cat-cow, I'm going to start by tucking my pelvis in, pressing through my hands to arch my back, and letting my head hang. So this is the cat position. And then move into the cow position. So I'm going to drop my stomach, rock my pelvis back, and lift my head up. So all we're going to do is slowly move back and forth between these two movements. Again, if you're experiencing some pain or some stiffness, you might reach a point that's a little bit painful. If you do, just stop right there so you don't have to do the full range of motion. Stop where you feel that pinch and go back the other direction. And what you'll notice is that the more you do this, the more you warm up and the further you'll be able to go the next time. Just don't feel like you need to push it to get the full range of motion. Keep it safe, keep it comfortable. And again, if you don't want to do the full body, you can just keep this in your hips. Again, with degenerative disc disease, usually it's in the lower back. So if you just want to focus on that low back, you can do that little tuck inward of that lower back, pushing it as far as you can, and rocking back. That feels pretty good. All right, moving into the next exercise. We're going to stay on our hands and knees. We're going to spread our knees just a little bit wider, bring our hands forward, and push through our hands. We're going to sink into a child's pose position. We're just going to hold this for a second or two. Rock back up. And then we're going to sink back down. So this child's pose position is just a great way to decompress that lower back. So again, degenerative disc disease a lot of times is caused by that repetitive compression of the spine over a long period of time. And so it feels good to just get a little bit of decompression in this spine. It's a great position to do that. So again, all we're doing, holding it anywhere 3 to 5 seconds. If it feels really good, you can stay there. Then we want to come back up. Let's go ahead and do one more. Sink those hips back. And done. Nice work. Next, we'll do sideline twists. So I'm going to go ahead and meet you on the side here. We'll have our arms right out in front. If you need a pillow, you can put a pillow here. Otherwise, just rest it on the ground. And from there, we're going to take this top arm and just drag it across the upper body and reach behind you. And then come back to the start position. So the only thing to watch here is, again, it's okay if your knee comes up a little bit off the ground, but the main thing is you don't want to rotate all the way over. We're going for that rotation in the lower spine. So we try to keep those hips and knees stacked, but don't stress if it comes off a little bit. And again, the other thing we want to focus on is the movement, right? So it feels pretty good just holding this static stretch, but with the DDD, we're not trying to stretch the muscles. We're trying to get movement in those joints of the lower back. And it's that movement that's going to help relieve the pain and stiffness. So we want to keep this slow and controlled movement to reduce that stiffness down there. Good. We'll flip to the other side, so you can just roll over. I'll come all the way over so I'm at least facing the camera. Good. And from here, we'll do the same thing. Arms stacked, taking that top arm and reaching behind you. Sometimes they call this exercise the archer because you can pretend like you're pulling a bow back as you perform this movement. But again, usually should feel pretty good. Just slow and controlled. Doesn't need to be fast. Again, we're just trying to get gentle movement in that lower back. Gentle movement. If you're ever in pain, I mean, this is for DDD, but any sort of lower back pain, the more you can get gentle movement in there, the better it's going to feel. The more you're going to be able to just get rid of that pain and stiffness. All right. Good. Now we'll move on to our back for the last exercise and my personal favorite, which are windshield wipers. So we're going to start bringing our feet a little bit wider than the hips. And from there, all we're going to do is drop our knees to one side. So I'll start with the right, drop it to the right. And again, with this one, it's okay if your hip comes off. And back to the other side. Again, you don't need to focus on keeping that hip on the ground. It's okay if it comes off. We're just getting rotation of the hips and rotation of your lower back. This is one of my favorite exercises. I do it pretty much before every workout that I do. It's a great way to get that movement in the lower back to help ease pain and stiffness caused by degenerative disc disease, just caused by regular age-related lower back pain, disc derangement, facet syndrome. It's just a really great movement to get movement in that lower back. Nice work. So that is the final minute. And again, this is feeling pretty good. You could do these exercises as long as you want, but to keep it short and quick, we got our 5-minute movement routine for degenerative disc disease. All right, that's all I got for you today. I hope this routine brought some relief from your degenerative disc disease. And just a reminder that movement is one of the best things that you can do if you're feeling any sort of pain and stiffness in that lower back. And you can do this routine as frequently and as much as you would like. So we performed each exercise for a minute. If you wanted to do those exercises longer, you can. If you wanted to do this 4, 5, up to 10 times a day, you can do it as much as you want. It won't stress anything. The more movement you can get in that lower back, the faster it will heal. So that's all I got for you today. If you have any questions or comments, leave them down below. Thanks so much for watching.